like I said, okay, like I said before, that the intent of this presentation is not to influence anyone for or against herbal remedies, and we don't want to influence anyone for or against the use of drugs, and we don't want to promote one over the other. We're not promoting drugs over the herbs or herbs over drugs, but what we are trying to do is to just make sure that we know what benefits we can gather from the use of natural remedies. So what we want to do is to just educate one another, and we'll start on looking at the history of herbal remedies. That's what I want us to move from. I want us to move from the history of herbal remedies, and then we see how these were actually used in the healing and treatment of sickness. Then the role of plant-based, animal-based, mineral-based materials in the production of drugs, even of medicines themselves. And then we see we want to promote God's method of living healthy, or healthy living. All right. Okay, sorry. All right. I just want us to look at this scripture verse. It says, dear friend, I pray that you may enjoy good health, and that all may go well with you, even as your soul is getting along well. This is 3 John chapter 1, verse 2, even as your soul. So there is a wish that we may live a healthy life, that we may get along very well, and that even our souls may be well. So that's the platform that we shall be moving from. But allow me, brothers and sisters, to just take you briefly to a very short study on pharmacology. I want us to look at pharmacology. Pharmacology is one of the studies in medicine, basically. It's another wing of medicine. But it mainly focuses on drugs and their interactions and with the living organism. That is, after you have taken a drug, how does it actually affect, how does it affect its healing powers in the organism or in the body? So the it is mainly concerned with the nature of drugs, their interaction in the body, drug dosages, side effects, and so forth. That's what drugs basically are for. Now, when you look at pharmacology, you find that pharmacology is also subdivided into various wings. You have what is called the pharmacodynamics, which looks at how drugs produce their effect. In other words, when you talk about a drug, you want to understand how is it going to bring a healing in your situation. If you're talking about a bacteria, how is this drug going to bring free you from bacteria? If you talk about pain, how is it going to free you from pain? Then we have what is called the pharmacokinetics. These are all wings of pharmacology. Then we have pharmacokinetics, which is a mathematical description of drug response based on time and dose. So in other words, how long does it take for a drug to bring upon effect on what you are trying to address in your health? Then we have what is called molecular pharmacology. Now, in molecular pharmacology, you talk about the chemical structure of the drug itself. That is, how is it made? How many arms, how many legs, how many ears does this drug have? Because those are the elements that this drug is going to use to bring about its effect on the body. But also it is critical and key that we must also look at the side effects, that is the toxic or poisonous effects of the drug. All these are important aspects when you look at medical pharmacology. That is, in other words, the pharmaceutical industries that deal with the production of drugs. When they produce their drugs, they look in all these aspects, and they have to make them public so that people are aware that after taking this drug, this is what I can expect, this is what is going to happen, this is how long it's going to have impact on me, and all that, and on all such things. Now, when you talk about drugs, or we talk about medicines, when you talk about a drug, the term drug itself, it is a Dutch word that is derived from drug, which means it's drug derived from drug, which means dry, basically. So which means drug means dry. That's its original meaning. That is the original meaning of drug. Then drug refers to the use of dried herbs and plants as medicines. So when you talk about a drug, you are actually meaning, you are referring in according to the olden days and the original information of drugs. When you talk about a drug or a drug, you talk about a dried herb, you are talking about a dried plant that is used as medicine. But also the word drug in Latin, it means medicina. So medicina is basically medicine. That's what it is. So if you look at it, if you say in mathematical, you say A is equal to B and B is equal to C, therefore C is equal to A. That's the theory of mathematics. If A is equal to B, B is equal to C, therefore C must be equal to A. Therefore, which means if drug is a drug and drug is medicine, therefore medicine is drug. So which means medicine, according to the original understanding of medicine, it means a dried herb or a dried plant. That's where originally this terminology comes from. And then medicine is basically administered for its medicinal values. So medicine, you don't just eat medicine as food. When you use medicine, you are actually want to benefit from its medicinal characteristics. Or it can be a therapeutic medicine. It can be a preventive medicine. It can also be used as a diagnostic agent. That's what medicine can be used for. Now, when you look at medicine or a drug as a therapeutic effect, it means it controls, it improves, it cures, and it cures the condition of disease. That's what it does. Medicine will improve, will cure, will control a condition of disease. For example, when you look at medicines and drugs, we have antibiotics, we have analgesics, we have hormone replacement therapy medicines that are used for that purpose. And all these, when you talk about antibiotics, these are basically used to kill bacteria or to manage bacteria. And then analgesics, they are basically used to control pain. They are used to control inflammation. Then, and then of course you have the hormone replacement therapies. But when you talk about preventive medicines or preventive use of drugs, you talk about vaccinations, you talk about drugs that are taken to prevent motion sickness, you talk about drugs that are used to prevent pregnancy. These are all drugs, but they have different purposes for which they are used. Then you have diagnostic use of drugs. These are used by themselves or in conjunction with radiological procedure. In other words, they can be used to color a certain area in order to identify the problem. So for example, sometimes you can be taken under an X-ray, but for the X-ray to be able to pick up the problem, you can be given a particular pill or you can be given a particular drug that is going to give color to the colon so that an X-ray can pick that up. So these are basically used to diagnose the problem. They are given to simulate cardiac exercises, and they are given in patients that cannot undergo regular exercise and stress testing. I hope we are still together, Elder. Now, let's move on. We are still together. Thank you, Elder. Now, let's move on. Let's look at the history of drugs. Let's look at the history of drugs. Here we know the story. We have the story of King Hezekiah. We know the story of King Hezekiah, and we know the story of the prophet who went to King Hezekiah. It says this story is found from 2 Kings. From 2 Kings chapter 20, verse 1 to 6. 2 Kings chapter 20, verse 1 to 6. It says, in those days, King Hezekiah became ill. He became ill and was at the point of death. The prophet Isaiah, son of Amos, went to him and said, this is what the Lord says, put your house in order because you are going to die. You will not recover. And the Bible says, but Hezekiah turned his face to the wall and prayed to the Lord. Remember, O Lord, how I have walked before you faithfully and with wholehearted devotion and have done what is good in your eyes. And it says Hezekiah wept bitterly. Before Isaiah had left the middle court, the word of the Lord came to him. Go back and tell Hezekiah, the leader of my people. This is what the Lord says. The God of your father David says, I have heard your prayer and seen your tears. I will heal you. On the third day from now, you will go up to the temple of the Lord. Then Isaiah said, prepare. I want us to look at this one. Isaiah, in fact, from what I see here, it's more like Isaiah said, go to a specialist doctor and let him treat your boils. Then you will recover. That's what Isaiah said. No, Isaiah said, prepare a poultice of figs. And this was instruction from God. Prepare a poultice of figs. Brothers and sisters, let me tell you, this poultice of figs is still a miracle even today in the treatment of boils. Prepare a poultice of figs. It says they did so and applied it to the boil and he recovered. So God knew what needed to be done. I like it in many versions because the New Century Version says, make a paste from figs and put it on Hezekiah's boil, then he will get well. Make a paste from figs and put on Isaiah's boil and he will get well. Another version puts it this way. Another version puts it this way. Press some figs together, spread them on a piece of cloth. Now, this is actually now explaining what a poultice is. It's giving you a detailed understanding of what exactly a poultice is. Spread it on a piece of cloth. Apply them to Isaiah's boil. Then he'll get well. This is what actually a poultice is. And this was meant to heal the boil of Hezekiah. This is figs, brothers and sisters. This is dried figs. And I want to tell you that these figs that we see here, you can use them even today as a poultice, and they will help you with certain conditions, especially boils. Now, I want us to also have an understanding that drugs are not a new thing. Drugs have been there. It's an old thing. It's not new. It's not the thing of our times. Sumerians and Egyptians used drugs as early as 2000 BC, which means even before Christ came to this world. The drugs were there. They were being used. At this time, I want us to move together. All right. Okay. I want us to move together slowly now. At this time, diseases were treated with, remember, medicine has been developing, but during this time, diseases were treated with frog's bile. They were treated with sour milk, lizard blood, pig teeth, spider web, hippopotamus oil, and toad's eyelids. This is how these were being used. These were the drugs of the olden days. And do you know that moldy bread was actually applied on abrasions? And it was later discovered that actually there is penicillin in the mold of bread. And modern medicine started to extract penicillin from the bread mold. This is nothing new. This thing is old. In the 1800s, an Egyptian medicinal scroll was discovered as far back as 1500 BC. It says this scroll contained 800 different herbal formulations and prescriptions already by 1500 BC. And Egyptians also extracted oil from medicinal plants. Egyptians already extracted oils in the same era. They extracted oil from medicinal plants known for their healing properties. Today we have oils that such as eucalyptus. Today we have oils such as tea tree oils. We have lavender oils. And these things are not there because of modern technology. They were there in the olden times, in the olden technology. In 1922, King Tata's tomb was opened by archaeologists, and they discovered 350 alabaster jars of plant oils near it. 1922. This was an old tomb, by the way, but already in that tomb, there's so many alabaster jars of oil were discovered, which shows that this is not new, it's an old technology. Now, ancient drugs, they were prepared according to standard and recipes. Preparation of these drugs, it involved drying, crushing, and combining. These were the drugs of the olden days. These were the medicines of the olden days. So a plant will be dried, or whatever is being used, it will be dried, crushed, and combined. These were combined, and then various plants will be put together in order to manufacture medicine. But in those days, people would combine these plants, just guessing as to what kind of impact or effect they will have on the health of the person. It says in some instances, patients were advised to eat soap. I'm just giving you the development of drug and medicine. They were given advice to eat soap to cure blood in the urine, and mercury in beer to cure intestinal worms. These were the things that were used in the olden days. Now, let us look at the modern, at how the modern drugs are derived in our days. Let's look at the drugs from plants. Let's look at drugs from plants, brothers and sisters. This plant is called foxglove. This is a foxglove plant, or it is called Digitalis lanata. This plant, brothers and sisters, is used to manufacture today's drug that is called digoxin. I want us to move together now. It is used to manufacture today's drug that is called digoxin or lanoxin. This drug is used to treat congestive heart failure. Even today, those who may know, these are the tablets I'm talking about. These tablets, they come from this plant. We have what is called belladonna plant, or it is also called a beautiful lady. This is an original source of two types of drugs, that is atropine and scopolamine. This was used, the berries from these drugs, they were used by Italian women to brighten their eyes. That is why it is called a beautiful lady. Because Italian women, they were using it and they will squeeze the berries in their eyes in order to make them bright and beautiful, the eyes. And atropine, it is still used to dilate pupil in patients with inflammatory conditions of the iris. Then we have what is called scopolamine, which is used for motion sickness. These two drugs, they come from this plant called belladonna plant. Let's move together. This is the plant I am talking about. That is diphenoxyl hydrochloride and atropine sulfate tablets. These are drugs that are actually manufactured from belladonna plant. So plants influenced the production of drugs. This is Scopocare. This plant is also sourced from the very same plant that is called belladonna plant. Now we have another one that is called Colchicum autumnale. Colchicum autumnale. This is a plant, ladies and gentlemen. This is a plant, it is a source of another drug called colchicine drug used to treat gout. It was also used for the same purpose in the 6th century, long as far as the 6th century. The plant itself was used to treat gout. So that we know how it looks like. These are the tablets that are made from this plant called Colchicum autumnale. Let's move on. This is another plant called ephedra. It is a source of another drug called ephedrine. It says the burning leaves treat respiratory ailments by Chinese medicine. This is a plant that is used by Chinese medicine to treat respiratory ailments. Today, this very same plant, it is made to manufacture an over-the-counter drug for bronchodilators. Bronchodilators. This is the plant I'm talking about, ephedrine. These are the tablets produced from this plant. I hope we're still together, Elder. All right.
Very much so. You are doing fine. Thank you so much,
Elder.
Doc.
Then we have ephedra. We have ephedra. This is an estrogen hormone replacement drug, which are derived from yams. They are derived from yams. Estrogen hormone replacement drugs are derived from yams. And let me tell you, ladies and gentlemen, that even today, natural medicine doctors, they use yams like Chinese yams. They use wild yams to treat estrogen hormone as an estrogen hormone replacement. These are the tablets I'm talking about, the capsules that are manufactured from this drug called ephedra. Let's move together. Artemisia. This is Artemisia. This is Artemisia annua. Brothers and sisters, let me talk about this one. It says there is relevant information regarding therapies from the 2000 to 2002 and 2003 outbreak of SARS-CoV in China. The researcher, this information is from a journal, a published journal, by the way. The researcher tested in vitro antiviral activities of Artemisia annua. Artemisia annua, for your knowledge, mhlonyana, or it's called wormwood. Now, it says this drug was tested by a researcher in vitro. Then it says Artemisia annua, whole plant preparation in ethanolic extract against SARS-CoV-19. That is SARS-CoV-19. I mean, SARS-CoV, sorry, SARS-CoV. So this was actually extracted using ethanol, if I may say. And it says with 50% effective concentration. Value of 3.5, 34.5 plus minus 2.6 milligrams per liter. And 50% cytotoxic concentration. The result affords strong support for the usage of Artemisia annua to treat SARS-CoV infectious diseases. This is a paper that is written by Lee et al. It's a published paper in a journal. It was proven that Artemisia annua, which is mhlonyana, was found to be effective on CoV, on SARS-CoV infectious diseases. Let's move together. The very same Artemisia annua, it says it contains what is called artemisinin. It is what is called as artemisinin. This artemisinin has been actually even commercialized as an anti-malaria drug. This is a study that was done by FF et al. 2008, just recently. As well as the value of artemisinin is not limited to the treatment of malaria. It is most promising natural products. A natural product that is important candidate accounting for the antiviral effect. In other words, from the research, it was found that it is one of the most promising plants against viruses. In addition, Artemisia annua, it contains sterols. that show virus inhibitory potential. Now, what does inhibitory potential mean? When you talk about something being inhibitory, which means it blocks. Remember, viruses, they work by attacking cells. So when they go to a cell, they attach themselves and they will open the receptors of the cells in order for them to move inside. So when you say it is inhibitory, it means it blocks the viruses from entering the cell. So it says Umhlonyana was found to have this potential of blocking the virus from entering the cell. This was a study that was done scientifically and in the laboratory and was published in a journal. Let's move on to animal-derived drugs. Let's talk about thyroid supplements. Thyroid supplements, these are composed of dried, desiccated thyroid gland tissues taken from animals. Ladies and gentlemen, drugs are more complex than we think we understand them. To treat a thyroid, an animal has to die, and a thyroid from the animal's throat or neck, it must be taken and dried to make a drug. These supplements are used to treat patients with hypothyroidism. We take drugs and we don't even know where they come from sometimes. Ladies, let's look at what we also know as Primarine. I know this one is used mainly by ladies. Primarine, drug companies, they get raw material to make synthetic estrogen from horse urine. It says it is derived from pregnant mare's urine. That's why it is called a Primarine, which means pre for pregnant, ma for mares, rin for urine. So it is used to relieve symptoms of menopause. Various devices are attached to pregnant mares to collect their urine, as we can see on the picture on the left-hand side. So these drugs, they are taken they will take urine from the pregnant horses and they will use them to manufacture these drugs. I'm sure we know them. These are drugs that are right there. They are out there. They are being used. It's called Primarine. This is another one, insulin. Recently, it says insulin was derived from the ground up pancreas of cows or pigs. Now, pancreas of cows or pigs, we know that insulin is the one, pancreas is the one that actually manufactures insulin. So what scientists will do, they will take the pancreas of these two animals, they will grind it, and then they will make insulin from them, and they will give it to us to treat this diabetes. Now, a huge amount of insulin, of pigs, sorry, are required for a very small amount of insulin to get it extracted from the pigs. In other words, for you to produce this small amount of insulin, you will need a large amount of pigs slaughtered and take their pancreases and use them to manufacture insulin. It says nowadays, I want you to take note of this. Nowadays, the insulin comes from vials, pens, and pumps, is not from pigs and cows. Rather, is generated from designer microorganisms. I want you to understand what it means when it says designer microorganisms, which means these are organisms that are manufactured and produced in the laboratory. So these are organisms that are otherwise not naturally available. When you say a clothing is a designer clothing, which means this clothing was not there, it is manufactured by a particular designer, which means in this case, scientists, they manufacture these microorganisms in order to generate insulin. Insulin of microorganisms is of more similarities to that of human insulin. That is what this is the motivation behind the production of insulin from designer microorganisms. Ladies and gentlemen, let me tell you, science is more complex than we think we know and than we think we understand it. Let's look at modern science in drug production. Maybe before we talk about that, let's look at what Ellen White says. Letter 82, 1897. Ellen White says, after seeing so much harm done by the administering of drugs, I cannot use them and cannot testify to their favor. I must be true to the light given me by the Lord. Now, we must look at this statement. Ellen White is saying she needs to be true to the light given by the Lord. This light is not from her. She has been given the light by the Lord. In other words, this light, it is not a light of a particular time. It is a light given to Ellen White by the Lord. So she needs to be true that she says, I cannot even testify in their favor after seeing what is done. In the vision of June 6, 1863, I was shown that more deaths have been caused by drug taking than from all other causes combined. If there was in the land one physician in the place of thousands, a vast amount of premature mortality will be prevented. Multitude of physicians and multitude of drugs have caused the inhabitants of the earth and have carried thousands and tens of thousands to untimely graves. Maybe this is Ellen White talking. Let's see if science agrees with Ellen White. Today's, I'm not talking about primitive science, I'm talking about today's science. It's a paper that I read, a publication, basically, it's a publication, published paper that it says about 8% of hospital admissions in the United States of America are due to adverse or side effects of synthetic drugs. Note this, we are talking about synthetic. Now, when you talk about something synthetic, you are actually talking about something that has not been there, that was just manufactured. I want us to look, there is a difference between synthetic drugs and natural, as we were saying in our previous slides, that when we talk about drugs, we talk about plants that have been pulverized, dried and pulverized and used as medicine. But this time, with today's science, we are talking about synthetic drugs. It says approximately 100,000 people each year die due to these toxicities. It means that the killed people in the US by pharmaceutical drugs are at least 3 times more than those killed by drunken drivers. Each year, also thousands of people die from supposedly safe over-the-counter drugs. Deaths in hospitalizations due to herbs are so rare that they are hard to find. Conventionally, it is said that if a drug is effective, it would have side effects. Brothers and sisters, I want to know that this is a statement from a published scientific paper, from a journal, authentic journal. It's a journal paper. The mechanisms by which the herbs generally act are not established. However, most of medicinal plants possess antioxidant activities. Most of medicinal plants possess antioxidant activities. You know, since I started to have interest on drugs, on the use of herbal medicines, I was wondering why most herbs, you will find that most herbs will be labeled antioxidant, anti-cancer, anti-diabetes, anti-this, and we wonder, is this herb for all diseases? Is it for all sicknesses? What is happening here? And I was always asking myself, until I found out that no, the reason herbs are like that is because they have these components in combination. All of them are combined. They are not isolated, which means from one herb you can extract a herb for cancer, a medicine for cancer, a medicine for this, a medicine for that. That's why when they are used in their natural form, they are able to do so many things because everything is put together in a plant. Now it says a pharmaceutical drug is usually designed to elicit a specific reaction, and its side or adverse effects are usually traded as risk against the benefit of the primary effect. Synthetic drugs address symptoms caused by specific diseases as understood by scientific pathology. However, a herbal medicine usually directed toward aiding body's own healing process. So this is where herbal remedies come in. When you are using a herbal remedy, you are actually empowering the body to fight against disease. You are not treating the symptom. You are not targeting the cough. You are not targeting the temperature, but you are targeting the body to fight by itself. In other words, you are boosting the soldiers of the body. You are not going straight to the cough itself, because coughing is only a symptom of an underlying problem. So a herb goes for the underlying problem in order to treat the cough. That's how herbs basically operate. Now, let me expand on bullet point number 2. It says pharmaceutical drugs is usually designed to elicit a specific reaction. Let me tell you, ladies and gentlemen, if we know, and if doctors know the drugs that are given to people, if we know what we are taking and what we are giving and what we are given also, there is a very public, the information for the use of these medicines is made public. There is a book that is called Physician's Desk Reference. It's called PDR. A PDR is a collection of all drugs that have been manufactured by pharmaceutical companies. And I can bet and I can tell you that even the vaccines for COVID-19, they will soon be included in the PDR, the next version of the PDR. PDR is basically updated every second or fifth year. That's how they do, they update it. They include the new drugs that have been manufactured. So what happens with PDR? PDR, you find that what pharmaceutical companies do, they submit the information about the different drugs that they are manufacturing. That information will have what the drug is, what the drug does, what are the side effects, the warnings against the drug. Don't use this drug for ABCD. The dosages of such drugs, everything is there. It's made plain. It's in the PDR. It's there. I have looked and I have studied the PDR. Ladies and gentlemen, I have studied it, and I can tell you there is not a single drug that does not have adverse side effects, including Panado that we buy over the counter. Not a single one. And I can tell you there are two organs that are always a target of drugs. Those organs is the liver and the kidneys. Those are the two organs that are the target of drugs. There is not a single drug that will not have an impact on the liver, that is not going to have an impact on the kidneys. Not a single one. And I can tell you that if you want to know this, it's there in the PDR. And I must say, fortunately, the PDR that I have, it also has supplementary medicines such as vitamin C, it has vitamin D, it has zinc, it has all these other vitamins that are also used in the treatment. And I promise you, ladies, I have looked in the PDR. I have looked closely. The PDR will declare that there are no side effects in the using or in the use of vitamin C. The only thing that you may have is diarrhea, which will only mean that you are saturated with vitamin C, which is actually not affecting you per se, but it's just that you are saturated by vitamin C. I have looked into these things. Now, Synthetic drugs are basically synthesized in the laboratory. That's what synthetic drugs do. Now, what happens when you talk about synthetic drugs? Let me move slowly with you here when I talk about synthetic drugs. Remember, we talk about the origins, the history of drugs in our first slides. That is, drugs, it was just pulverizing and encapsulating, pulverizing and making tablets, all those things. But this time, pharmaceutical companies are actually synthesizing drugs using chemicals. Now, these are manufactured in the laboratories. Drug companies, they change parts of the original natural molecule to make something they can own or sell. This is why today, when you talk about vaccines today, we have Moderna, we have AstraZeneca, we have Pfizer, we have all these different vaccines. And I tell you that Moderna owns Moderna. Pfizer owns that one. AstraZeneca owns it. And you cannot manufacture that vaccine without the consent of the originator of that drug. That's what synthesizing of drugs comes from. Because pharmaceutical companies want to have ownership. They want to have a monopoly over medicines. That's what is happening. This is very applicable in the agricultural industry with genetically modified foods. I want to pack a bit here on genetically modified foods. Let me tell you, ladies and gentlemen, we have our own small health shop in my place. And one of the things that we sell there is organic. It's non-genetically modified meal. That's what we sell, non-genetically modified meal. And I collect this meal directly from the farmers that produce corn that produce non-genetically modified corn. When you talk about genetically modified seeds, genetically modified seeds are done so that manufacturers have ownership of the seed. In other words, the seed is not for everybody, it's our seed. That's what genetically modification of food does, basically. It promotes monopoly and ownership of these seeds. So you cannot even plant a genetically modified seed in your farm without applying for a right to do that from the manufacturers themselves, like Monsanto. So the farmer was telling me that the way it is so terrible, if you plant your genetically modified maize meal in your own farm, if by any chance a bee happens to fly from a farmer that is producing genetically modified foods and to comes and pollinate your field or your farm, your own crop, you can be arrested once a gene is found in your own crop. That's how these things are just meant to promote monopoly or in foods. It's going to become very difficult to have access to these foods. Altered molecules always have side effects on the human body. For example, let's talk about progestin. It is a synthetic progesterone. There are natural progesterones that are available, but scientists and pharmaceutical companies decide to produce progestin because they can have ownership of the progestin. So it says all these that have been altered, that are not natural anymore, they will definitely have side effects on the human body, because the human body will have to recognize every time you eat, the human body must recognize the food that you are eating. When the food is not recognized, it is going to be treated as if it is a foreign subject into the body. This is why, ladies and gentlemen, today we have such an increase of allergies amongst people. It is because the food that we are eating is foreign to our bodies. Our bodies, our cells cannot recognize it, and then we become allergic to such foods. Possible benefits of progestin. Now it says possible benefits of progestin is protect from endometrial cancer, but all of its other aspects are negative. What does this say to us? This says to us, in the manipulation of these natural remedies or natural medicines in their manipulation. They are manipulated because pharmaceutical companies want to achieve certain goals by manipulating them. Therefore, there are some things that you may benefit from them, but versus the side effects, you will need to make an informed decision whether to use or not to use. I want us to look at this one. This is progesterone. I hope we have chemists here in this platform.
Hi, Doc. Yes, we have what?
Thank you. Thank you, Elder. Here we have a natural progesterone. And then we have what is called the medroxyprogesterone, which is progestin, basically. I want us to look at these two molecules. This is where we talk about the molecular structure now of the drug. That is how the drug looks like. When you take it under scientific analysis, you take it through the machines and everything. This is how the drug will look like. So progesterone, natural progesterone, it looks as we see it on our left-hand side. But scientists, because this cannot be patented, this cannot be owned by an individual. This cannot be, you don't need a right to use a natural progesterone. So pharmaceutical companies, in order to produce something that they can take ownership of, they needed to play with this natural progesterone. Play with it and tweak it a little bit so that it can become different, but still do the same thing that they want it to do. If you look at it, I want us to look at the top right of the molecule. There we have a double bond O and a single bond. We have a double lines and a single line there. If you look at the molecule on the white line, that molecule on the white line, you can see that the tweaking was to just add two O's and another double line. This is what is done because this, when the pharmaceutical companies changes this to what we see on the right-hand side, then the pharmaceutical company can take an ownership of what is on the right-hand side and say, this is mine. Therefore, the pharmaceutical company can then sell this at a price because it is not natural. It is not natural. It cannot be owned by everybody. This is what happens. But the trick now is that when you tweak the natural and you make it the unnatural that we see on the right-hand side, even the effects are going to be very different. When you take the one that has been manufactured on the right-hand side, it is going to have some side effects because it will not be recognized by the body as the body should know it. I want us to look at another one called diethylstilbestrol. This is another drug that was used actually in the medical fraternity. This is another synthetic non-steroidal estrogen. It's an estrogen drug. It is manufactured by joining p-anol. I don't want you to worry about these terms that I'm using. I just want you to look at the pictures that I'm talking about. It is manufactured by joining two p-anols. That is tail to tail. A p-anol is another molecule that we will see as I proceed. So it is and p-anol is basically a natural molecule. It is a natural steroidal estrogen, a p-anol. But because in its natural form, it cannot bring money to anyone because it is freely available and it is natural. So for a pharmaceutical company to make money, it has to play with the molecular structure of p-anol to produce something that is not naturally available. So natural p-anol, which is a natural molecule, it is actually p-anol is found from fennel and is found from anise. These are plants. Ladies and gentlemen, these are plants that anyone can plant. It is found from fennel, it is found from anise, and these are used to control estrogen. P-anol, it is a natural phenyl propanoid. That's how it looks like. Fennel and anise have estrogenic properties and are also used as regulators of menstrual cycles. So which means therefore that you can take fennel, you can take anise in its natural form to control your menstrual cycles basically. But because there is no money involved here, scientists and pharmaceutical companies needed to come up with something that is believed to be more effective, which is, of course, going to be more effective. But it's going to be more effective, not just in the treatment of the symptoms, but also in other toxic aspect of the drug itself. What we see here, we see p-anol. That is a natural molecular structure that we see, the p-anol. Now, what pharmaceutical companies will do, they will take these p-anols and bring them together and join them tail to tail, as we see on the right. Then they will manufacture something like this, which is diethylsterol. This is what we call an estrogen drug, basically. This is a drug that has been there for years. It's been there, it's been used. But this drug, it was actually coming from a natural form, and it was then manufactured and changed into this unnatural form. There is no plant that has got this diethylsterol. It is not found in any plant. This is a designer drug, basically. It is made solely in the lab. When you introduce it in the body, it will definitely have some impact, some effects on the body, because it is not natural, it is not recognized by the body. This is the diethylbin. It's actually the diethylsterol. Now, I want us to move together here very carefully, because I'm going to talk a lot about this diethylsterol. It says for decades, DES, which is actually this drug that I just showed, DES was widely prescribed to pregnant women until it became clear, after accumulating more than 40 years of data, which means this drug was used for 40 years before it was found that it actually affects the health of the people. It was used for 40 years, ladies and gentlemen. It says 40 years, and it was found to cause delayed cancers in offspring daughters. It was manifesting in their late teens and early 20s. And let me tell you something. Diethylsterol, having been used for 40 years, how many people died from using this drug for 40 years? And if this drug only manifests its effects, its side effects, at a teen stage, and it was used by pregnant women, but only manifests its effect at a teen stage, I want to tell you, ladies and gentlemen, that it took a genius to actually link this drug to this effect. This was established in 1970, and soon DES became illegal to administer to expectant mothers. It became illegal. It was banned, in other words. The drug was finally banned after it was found out that it was carcinogenic, not only to children of expectant mothers, but to adult mothers themselves. It was causing cancer to them after 40 years of usage. It says by this time, thousands of mothers were already diagnosed with cancer. Brothers and sisters, let me tell you, cancer is rife in our days. It is rife. If there is a pandemic that we can talk about cancer. That's the pandemic that we have that is killing a lot of our brothers and sisters and a lot of our parents. Now, we need to understand that pharmaceutical companies want products that are patentable. When you say patentable, it means this product can actually be owned by a company or by an individual, because it is a novel idea, something that has never been there before. So it is illegal to patent a natural product. You cannot patent a p-anol from phenol, because it is a natural product. And there is money in producing unnatural substances that never existed before. There is money, there is a lot of money. I worked for a research company, ladies and gentlemen, and as researchers, we were always pushed to come up with patentable products. all the time, come up with a patentable product, because our department would make money from producing a substance that has never been there before. When you patent a product, then you create monopoly. That's what you do. Generally, drugs are unnatural to human body. Even according to PDR, as I have said, there is no drug that does not have side effects, as I have already said. This statement that I was trying to bring about, they are in a way agreeing with the statement that Ellen White had said, that she cannot with conscience continue using, knowing what is happening. Several of the students are in doubt. Now, this is a question that was posed to Ellen White now. It was a letter that was written by Edgar Caro to Mrs. White. Several of the students are in doubt as to the meaning of the word drug, as mentioned in How to Live. Does it refer only to the stronger medicines as mercury, strychnine, arsenic, and such poisons? The things we medical students call drugs, or does it also include the simple remedies as potassium, iodine, squills, etc.? We know that our success will be proportionate to our adherence to God's method. This is what Edgar says. For this reason, I have asked the above question. Listen to the response of Mrs. White. Your question, I will say, I will say unanswered. Your question, I will say, unanswered largely, if not definitely, in How to Live. Is they are answered largely, if not definitely, in How to Live. Drug poisons mean the articles which you have mentioned. The simpler remedies are less harmful in proportion to their simplicity, but in very many cases, these are used when not at all necessary. They are used when it is not necessary. There are simple herbs and roots that every family may use for themselves and need not call a physician any sooner than any would call a lawyer. I do not think that I can give you any definite lines of medicine compounded and dealt out by doctors that are perfectly harmless. I cannot give you anything that are dealt by that are perfectly harmless. And yet it would not be wisdom to engage in controversy over this subject. This is exactly how I feel, brothers and sisters. She says it will not be wisdom to engage in controversy over this subject. Ellen White says, train the people to correct habits and healthful practices, remembering that a course of prevention is of more value than a pound of cure. A course of prevention is of more value than a pound of cure. Lectures and studies in this line will prove of the highest value. In other words, educate people on healthful habits and correct habits in order to live healthfully. Natural surroundings and hydrotherapy, more effective than drugs. The things of nature are God's blessings, provided to give health to the body, mind, and soul. They are given to the well, to the well to keep them well, and to the sick to make them well. Natural remedies, in other words, it says you can use them whether you are well or whether you are sick. You can use them. Connected with water treatments, they are more effective in restoring health than all other medications in the world. Let me tell you, brothers and sisters, hydrotherapy is one of the most powerful treatments against fevers, including COVID-19, by the way. It is one of the most powerful treatments. And I'm saying this because we have actually used it ourselves. It is of no use to have seasons of prayer. Listen to this one. It is of no use to have seasons of prayer for the sick while they refuse to use the simple remedies which God has provided and which are close to them. Why you do? Another one says, it does not help to pray for them when they refuse to use simple remedies. If there is an unsanitary condition of things in the house and about the premises, the very first thing to take is to take up the work that has been neglected and cleanse and purify the house and premises, making everything sweet, that the atmosphere may not be tainted by the least offensive smell. I have read books, I have read articles, I have read many documents. And some of the books that I have read, they actually allude to the fact that some pandemics were actually overcome through sanitary conditions by just making sure that people are living under sanitary conditions. For example, conditions like cholera. Most of them, it says that they were actually caused by unsanitary conditions under which our people were living. One of the most beneficial remedies is pulverized charcoal, placed in a bag and used in fermentations. This is a most powerful remedy. If wet in smart weed boiled, it is still better. I have ordered this in cases where the sick were suffering great pain, and when it has been confided to me that the physicians that he thought it was the last before the close of life. Actually, Ellen White says this because there was a time when she was approached by a medical doctor who was treating a student at a camp who was sick. And this doctor was doing everything to try to save the life of the student. But the doctor realized that the student was dying and ran to Ellen White and said, the student is dying, what can I use? And Ellen White says, go to a locksmith, go to a smith and get charcoal from there and use it for this student. And it says the student recovered in a short space of time. And even the doctor acknowledged the power of the charcoal. Medical fraternity. This is Ellen White talking, brothers and sisters. This is Ellen White talking here. She says, medical fraternity represented to me as Freemasonry, with their long, unintelligible names, which common people cannot understand, would call for the Lord's prescription of Hezekiah quackery. Death was pronounced upon the king, but he prayed for life, and his prayer was heard. Those who had the care of him were told to get a bunch of figs and put them on the sore, and the king was restored. What does this statement say? The statement says, if you were to tell some of the medical doctors that they must use a fig, they will laugh at you, and they will say you are a quack, basically. That's what they will say to you. That's what Ellen White says. So natural remedies, we should not expect them to be accepted by everybody. Now, cholera pandemic, look at cholera pandemic in the 1950s when there was an outbreak of cholera pandemic. The priests and preachers and everybody, they ran to Palmerston. They were like, oh, we need to pray because of this pandemic and let people be saved from the pandemic. This is what Palmerston says. When Lord Palmerston, Premier of England, was petitioned by the Scotch clergy to appoint a day of fasting and prayer to avert the cholera, he replied, cleanse and disinfect your streets and houses, promote cleanliness and health among the poor, and see that they are plentifully supplied with good food and raiment, and employ right sanitary measures. Generally, you will have no occasion to fast and pray, nor will the Lord hear prayers nor will the Lord hear your prayers while his preventive remains unheeded. In other words, if you don't take care of your sanitation, your sanitary requirements, even if you pray, you will not be healed. There is a need for you to also play a part and take care of your environment. So cholera pandemic in the 1950s was overcome by improving sanitary conditions, by employing right sanitary measures and promoting cleanliness amongst the people. This old man is Mammon Wilson.
Sorry, Doc.
Yes, sir.
Just a moment.
Yes,
How
sir.
far are you from wrapping up your presentation? The question I'm asking is that.
Yes, Doctor. Yes, Prof.
Remember that I said we wanted to get enough time for people to ask questions. The suggestion would be that if you are still far from finishing off, we might have to probably maybe cut it into half, have part one of this program or presentation, and give people an opportunity to ask questions, and maybe arrange very, very soon another part two of the program. But if you have to very close to wrapping it up, I don't have a problem. You can wrap it up. But if you still have quite a lot of things to say, yeah,
can I have 10 minutes, Elder, to just wrap it up?
That's fine. That's fine. I'm not rushing you. I just want you to say whatever that you want to say. So I just wanted to check.
No, I understand. I understand.
No,
I'm almost there.
Yeah. Oh, great.
I'm almost there. I'm almost there. Yes. This is Mammon Wilson. He's one of the medical missionaries known in the United States of America. He's actually one of the gentlemen that also inspired me to follow this field. This gentleman, I must say, brothers and sisters, that God has revealed so much to him that he can even conduct surgery by only using herbal remedies. He can cut a tumor using a herb out of a patient. He once treated a stage 4 cancer patient, and he was invited, and the doctor was so shocked that he invited him to come and present before the students in a hospital, in an academic hospital. He went there and he presented, and he says when he went there, he went out like a wet duck because people laughed at him. They said he was a quack that they've never seen before, because he presented simple natural remedies of what he used to assist a stage 4 cancer. This is another client that we had as well in our center. He came with this condition, and when he explained to us, he says this condition was actually, he had it from hospital. They were putting a drip on his leg, but they could not identify, they could not find a vein on the arms, and then they decided to put a drip on the foot. And then that messed up his foot like that. And then he was discharged and was told to come 3 weeks later. But he could not wait because this thing was so spreading that it was going to affect the entire leg, basically. And then he came, he was referred to us, and he said, just help me. When I looked at this foot, ladies and gentlemen, the toes that we see there were totally dead. There was no hope of life anymore. You could actually put a hammer and break them with a hammer, and he will feel no pain. That's how they were. So the only option that we were left with was to try and arrest this condition, not to go up the foot, so that he can end up with the whole leg cut. So we worked with him for 10 days. Then after that, I said to him, you need to have that part cut. And I fortunately had a doctor that I knew from the hospital. I said, please help this gentleman, let him get cut those toes so that at least the foot can be saved for him to be able to still use the foot without the leg being cut out. And this is how the foot turned out to be after it was cut out. Not about a few months ago, I received a report from this gentleman. He actually sent, he was thanking us for helping him. And this is what he was doing, trying to show us. By this, he was actually trying to show us that he has been totally healed and he has recovered. In conclusion, brothers and sisters, maybe let me move faster here. Eat food, eat good food. This is Isaiah chapter 55, verse 2 to 3. Why spend your money on food that does not give you strength? Why pay for food that does you no good? Listen to me, and you will eat what is good. You will enjoy the finest food. This is a verse found in the Bible. It is found in the Bible, brothers and sisters. Why spend your money on food that does not give you any strength? Why pay for food that does you no good? Now, this is another verse that is also found in the Bible. Now, I urge you to take some food. Now, I urge you to take some food. You need it to survive. Not one of you will lose a single hair from your head. This is found in Acts 27, verse 34. Now, ladies and gentlemen, as I close up, what do we see here? Can anyone read this for me? Is there someone who can read this for me? I guess no one can read it. Ladies and gentlemen, let me tell you, this is a stop sign in Chinese language. And I want to promise you, go to China and you can't speak Chinese and you can't read Chinese. Go to China and drive in China and do not stop at this stop sign. And tell me if you will not get a ticket. I don't care. Chinese will not say, do you understand the language or not? They will arrest you. They will give you a ticket. Whether you understand or you don't understand, you have passed a stop sign. Here is another sign, ladies and gentlemen. This is another stop sign in Japanese language. Go to Japan, drive in Japan and pass this and do not stop. You will get a ticket. Why am I saying this? I want to tell you, brothers and sisters, that you don't stop at the stop sign for your health. Your health will penalize you. And your health does not care whether you understand or you don't understand. Health is a life or is very unforgiving. You eat things that your body does not want, your body will not forgive you. Your body will make you suffer. Whether you can take poison knowing it is poison or you don't know, if you take it, your body will not say, no, he did not know, she did not know. It will kill you. Poison will kill you. If you pray, if you pay attention to these laws and are careful to follow them, then the Lord your God will keep his covenant of love with you. As he swore to your ancestors, he will love you and bless you and increase your numbers. He will bless the fruit of your womb, the crops of your land, your grain, your wine, and olive oil, the calves of your herds, the lambs of your flocks in the land he swore to your ancestors to give you. You will be blessed more than any other people. None of your men and women will be childless, nor will any of your livestock be without young. The Lord will keep you free from every disease. He will not inflict on you the horrible diseases you knew in Egypt, but will inflict them on all who hate you. These diseases, in other words, says these were not meant for them. They were meant for other nations. Thank you, Elder.
Hey, Doc, this was really mind-blowing, mind-blowing. I'm sitting here and I'm just, saying the Lord is good for him to allow us this kind of information. Friends, without any waste of time, I think now it's almost 7, and maybe we can allow questions for another 30 minutes. I can give you 30 minutes to engage with the doctor. If you have any questions, please feel free to do that. Raise your virtual hand. I don't want to comment. I've got quite a number of questions, but I don't want to ask them. I want to give you an opportunity. If you have a question, raise your virtual hand. I saw someone, Doc, in the meantime, whilst our people are still raising their hand. I think he was asking about the seedlings, the seedlings that you plant, that we get from nurseries. Are they genetically modified, or what about them? Whilst we are waiting for others, but I can only see appreciation from our people here. I can only see appreciation. And people are very, very excited and glad that they are part of this presentation. But can you answer that one whilst we're waiting for people to raise their hand?
Elder, I will not be able to give a precise answer to that, but I must say that most of the crops, they are genetically modified, most of the crops. The problem comes when you start to produce them for commercial purposes. That's when now the issues of the law come in, when you start to produce them for commercial purposes. But most of them, especially tomato, I know that tomato is about 95% genetically modified. Tomato and soya beans, and other products, there are lots of other products that have been genetically, many products are basically genetically modified, including those that we buy from nurseries.
Yeah, and maybe just a quick one. What are the side effects of mhlonyane? Can you overdose mhlonyane? Can you drink it much? And how often are you supposed to drink it if you have it? Yeah, what is your take and what is your recommendation on that?
When it comes to natural products, my elder, I must say that, for example, in the case of mhlonyane, for example, there is not, so far, there is no reported case of someone who became ill or who was affected to the point of hospital admission by mhlonyane, and it was traced to the use of mhlonyane. But this does not say that there is no limit in the use of mhlonyane. Remember, like we said in our first slides, that there are very few side effects that can actually be associated with the use of herbs. But it does not mean that there are no side effects in the use of herbs. The concentrations, they become an issue. How concentrated is the herb that you are using, in what form you are using it, and all that. Herbs do have certain effects on us. But when it comes to mhlonyane, there is no reported dosage as to how you can use it. But in our case, we do produce tinctures of mhlonyane, for example, and we use it in drops because we concentrate mhlonyane. So from our tinctures, you only use about 15 to 20 drops. These are just tinctures like those that you buy from Discam and all that stuff.
Okay, let me give others a chance. Molly, Sister Molly, unmute yourself and just be straight to the point. And Brother Mdebele, I've noted your hand as well. Sister Molly? Let me try and unmute yourself. Yes, you can unmute yourself. Now you can unmute yourself. Sister Molly, you are able to unmute yourself now, please. All right, Brother Mdebele, are you able to unmute yourself?
Good evening, brothers and sisters. Am I audible?
Yes, you are audible. You are no more Brother Mdebele, now you are Dr. Mdebele, my opponent.
No, I'm a kid. I will just address the issue of seedlings and GMOs. I'm an agricultural specialist. I think we've spoken with Dr. Mema a few times. What we should be worried about, it is what we buy as fresh or in the shelves. Unfortunately, the way science has advanced, most of these, especially spinach and a whole lot of other vegetables, unfortunately, they've been genetically modified. But the main aim is how do we manage them? If you have to worry about what kind of spinach do you have that would have adverse effect, rather have the seeds, plant it at home, apply organic farming practices, and then you are on the right track. Fortunately, God has also provided alternatives in what we call African leafy vegetables. Within the South African context, Southern African context, there are certain what we call vegetables that we neglect. We call them weeds. Those ones, you still find them in the wild, especially if you go Malawi, Zimbabwe, there's Mozambique, there's a whole that we call weeds that we should be eating, that have also equal amount of nutrients that we can benefit from. So an answer to that would be, let's learn from other cultures, we can learn from others. Fortunately, as a church, we're a diverse church, where we have in one building, you could have people from all over the world. Let's learn from each other. I think that's what would be very important. I'm not sure if I've addressed that question, the one that was asked about GMOs. Yes.
Thank you. Thank you.
Yes, you have
that's very important.
Maybe the person. I think it was Moss was asking the question. Yeah. Thank you so much. Let's move to Molly. Molly, I'm giving you another chance. Can you talk, please? Thank you, Doc Mdebele.
Okay, Doc. Thank you very much. My question was, I think he just gave the answer. I wanted to ask about the seeds that we buy in the shops. That are they genetically modified, and what should we do to prevent that? And I also wanted to ask about vaccinations. Like I was battling with the decision whether I should go vaccinate or not vaccinate. But after listening to this presentation, I'm quite sure, Doc, it's not really wise for me to vaccinate, right?
Okay, okay, Sister Molly.
It's not me who told you not to vaccinate, my sister, please.
Yeah, yeah, you made your decision after the presentation. Thank you so very much. I've seen a few questions from the platform. Is there any book? All right, a question, Masabata Mtweku. Let me just read yours because it just came. Can intermittent fasting, elimination of refined foods, carbohydrates, and dairy products reverse the cancer cells growth for someone with cancer, colon cancer or liver colon, that is? Who does chemo? Can they come to you as well? Okay, I think you can read it for yourself there, but I think he has a few questions there. That intermittent fasting, can it eliminate and refine foods and all this cover? Can they kind of, I think read it over there, Doc. It will make sense to you.
All right.
And someone who has cancer come and consult with you. I think that's the last part of the question.
All right. Thank you, Elder. I can see the question here.
Yeah.
I cannot provide a very simple answer when it comes to a sickness, especially cancer. Cancer, I must say that this is one that's why I was saying cancer is a pandemic on its own. It's a pandemic that needs to be taken cognizance of. Actually, I've got another presentation that is just on cancer issues. But I must say that cancer is rife and it's dangerous and it kills a lot of people. However, I must say, even with cancer, there are things that people can do. And remember, when we are saying that go for natural remedies and all that, we're not saying there will be no people that will die when you use natural remedies. But we are saying it is good also to consider using them. But there are people that have actually survived cancer after changing their diet. There are people that have survived cancer after using natural medicines. And also there are people that have died even after changing diet and using natural remedies. There are people that have died, but the cancer issue is very complex. Yes, we do have clients that have cancer that have come to us. A few months ago, we had a client that has a prostate cancer, a stage 4 prostate cancer that came to us. And I think his PSA was almost 100. And we worked with him for 10 days. And by God's grace, we were able to reduce his prostate to 30. And we told him that this is not the end of it. You still need to continue with the lifestyle issues and all that. Cancer is another, because it can live and come back very strong than before. So there is a way of doing it. There is a way of doing it naturally, I must say. But it's not an obvious case. There is a lot that needs to be done, and there are lots of sacrifices that must be done when it comes to any condition for that, be it diabetes, be it high blood pressure. There's a lot of things that can actually affect the treatment of a condition. Thanks, Elder. Are you still there, Elder? Or is it me who has been logged out? Am I still on, or am I not there anymore?
No, yeah, here. Yeah.
Oh, thank you. I thought maybe I was logged out.
Okay, I think there's a problem with connection of Rambinga. Do we have any other question on the floor.
Yes, I raised my hand, I think, because Elder Mbia is the one who recognizes, does not see me.
All right,
You
I'm
can go
back.
ahead.
Hello?
I'm back on another gadget here. The other one just went off. Sorry about that. Sorry about that.
Okay, thank you.
I thought your hand was up by mistake, my brother, because you were up at the time. Okay, fine. Just go for a question now.
Mine is just a short comment.
Yes.
Yes, just to support the whole presentation. I'm working for the vegetable and ornamental plants campus, which is in the Agricultural Research Council. Fortunately, most or a few of those medicinal plants, we plant them at work. And then there's also documentation if some people would want to have to see them and also know what they are, so that they are able to appreciate them better. Maybe it's better if the whatever Artemisia annua or any other one or any of those plants that would be helpful, you go see them at work or wherever they are planted, you take them, you plant it in your backyard garden, you have something written, and then you are more comfortable, because some people would not prefer concoctions. They would rather prefer those things to be planted. So those options are there. I would liaise with the church leadership if people want more information on that, so that we provide even more genuine information, and maybe even a field trip just for people to appreciate those medicinal plants live, than to find them in a bottle at this camp. They are plants that can grow on the soil, not only in shelves.
Okay. Thank you so much for your offer, Dr. Mlebele. Thank you so kindly. Maybe for the purposes of those who are not members of Acacia, what you can do, you can just drop your contact details in the chat so that whoever wants to get more information can contact you directly. Thank you so very kindly. But for members of Acacia, we know where to find you and to get you. Any other questions, friends? We still have time. I can take a few hands. We still have about 15 minutes that we can allocate. All right, yeah, it will be okay. Let's go to the chat. Where can we buy the doctor's product? Okay, you will answer that one, Doc. And what is the role and importance of insulin resistance in healing inflammatory diseases? Doctor, you can see that one? Okay. Doctor, what natural herbs can I use for a severe acne instead of using Oratane tablets? Dr. Mema, can you just drop your, can you come back to the screen and just stop sharing so that we can see you proper?
Okay. Yes, let me do that.
Unless if there would be a need to refer, but for now it looks like you have everything in your head, unless someone wants to read for themselves. Yeah, you can just drop that. Thank you so kindly.
Let me do that.
I have read those. You can just answer them as they follow each other.
All right. Sorry.
And whilst Dr. Mema is doing that, can I as well let you know that I was talking to the elders of the records. We will talk to Dr. Mema soon to check how soon can he come back to the platform again and address other issues. I know we have burning questions, we have burning issues, and I'm sure Dr. Mema will be happy to come back here again. If that's a problem, Doc, to take it off the screen, don't worry. Just concentrate on the question.
Yeah, I'm trying to do that. It looks like I'm being challenged.
Don't worry, leave it. Go back to the questions. Yeah.
All right, Elder. Let me just check the questions quickly. Okay.
What is an importance of insulin resistance in healing inflammatory disease?
Insulin resistant. Let me see. What's the role and importance of insulin resistance in healing? Oh, I'm trying to understand this question. What does it say exactly?
Sister Masabata,
my understanding is that insulin resistance is very core And
Yes.
it's the main reason why people have all these diseases, be it cancer, be it high blood pressure, you know, because there is no balance. There's no sensitivity towards insulin, be it diabetes, all these diseases, they center around that. If insulin sensitivity is corrected, then someone gets to be fine. You know, be
All right.
it acne or whatever, you know, you see in the, with the teenagers, etc. So I don't know if you know anything about that.
All right. I think, okay, I think, Elder, this is another school of natural medicine, the insulin response. Because what we do in our case, we run our own tests. Whenever you have a problem, we run our own tests and we identify what could be off that needs to be brought back to normalcy. So I want to, from the explanation of our sister here, it looks like this is another school of natural medicine that believes in where there are so many, so diverse